Have you ever wondered how to recognize the early warning signs of a stroke? It's a topic that holds critical importance, especially for those caring for elderly loved ones. But fear not, because today we're here to uncover the 9 crucial warning signals that should never be ignored. So without further ado, let's jump right in. Number 1. High blood pressure. High blood pressure, medically known as hypertension, is a significant risk factor for strokes. This is because elevated blood pressure puts increased strain on the blood vessels throughout the body, including those in the brain. When blood pressure is consistently high, it can lead to a weakening and narrowing of the arteries, a condition known as atherosclerosis. Atherosclerosis can cause the buildup of fatty deposits, or plaques, on the inner walls of the arteries. Over time, these plaques can rupture or form blood clots. If a clot or a piece of plaque breaks loose and travels to a smaller blood vessel in the brain, it can block blood flow, leading to an ischemic stroke. Additionally, high blood pressure can also cause small blood vessels in the brain to burst, leading to a hemorrhagic stroke. This occurs when the weakened blood vessel ruptures and bleeds into the surrounding brain tissue. Number 2. Fatigue. Fatigue can be a sign of stroke due to the impact that a stroke has on the brain and the body's overall energy levels. When a stroke occurs, it disrupts blood flow to certain parts of the brain, leading to a reduction in oxygen and nutrient supply. This deprivation of essential resources can result in a variety of neurological symptoms, including fatigue. The brain is a highly energy-demanding organ, and it relies heavily on a constant and adequate supply of glucose and oxygen to function optimally. When blood flow is compromised, the affected areas of the brain may struggle to maintain their normal metabolic processes. This can lead to a sense of overall weakness and tiredness, which is commonly experienced as fatigue. Number 3. Vision problem. Vision problems can be a sign of a stroke because the brain relies on a complex network of blood vessels to receive the oxygen and nutrients it needs to function properly. When a stroke occurs, it means that blood flow to a certain part of the brain is disrupted, either due to a clot blocking a blood vessel or due to a blood vessel rupture. The brain has specific areas responsible for processing visual information, located in the occipital lobe at the back of the brain. When this area is affected by a stroke, it can lead to various visual disturbances. These may include sudden blurred vision, difficulty seeing in one or both eyes, or experiencing double vision. Furthermore, a stroke can also impact the communication between the brain and the eye's muscles, leading to problems in eye movement and coordination. This can result in difficulties in focusing or following objects with the eyes. Number 4. Sudden headache. While a sudden headache is not the most common symptom of a stroke, it can be a significant warning sign in some cases. This type of headache is often referred to as a thunderclap headache due to its sudden and severe onset, often described as the worst headache a person has ever experienced. A sudden headache can be indicative of a hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures and causes bleeding into the surrounding tissue. This can lead to an increase in pressure within the skull, resulting in a sudden and intense headache. It's important to note that not all headaches are related to strokes, and most headaches are benign and not a cause for concern. However, if a headache is sudden, severe, and unlike any headache the person has experienced before, it should not be ignored. Number 5. Numbness or weakness in limbs. Numbness or weakness in limbs occurs due to a blockage or rupture of a blood vessel, which deprives a specific area of the brain of the oxygen and nutrients it needs to function properly. The brain is responsible for controlling all bodily functions, including movement and sensation. It does this through a complex network of nerve cells that transmit signals between the brain and the rest of the body. When blood flow is compromised, as in the case of a stroke, these signals can be interrupted. When a stroke affects the region of the brain responsible for controlling a particular limb or side of the body, it can result in numbness or weakness in that area. This happens because the nerve cells in the affected region are not receiving the necessary oxygen and nutrients to function normally. As a result, they become less responsive, leading to a loss of sensation or a reduction in muscle strength. Number 6. Difficulty in speaking. When a stroke occurs, it means that blood flow to a part of the brain is either reduced or completely blocked. This can happen due to a clot or a ruptured blood vessel. The brain has specialized regions responsible for various functions, including speech and language processing. One of these regions is called Broca's area, located in the frontal lobe. Broca's area plays a crucial role in producing speech. When this area or the nearby regions are affected by a stroke, it can lead to difficulty in speaking. The specific symptoms of speech difficulty can vary. Some individuals may experience slurred speech, making it challenging to articulate words clearly. Others may find it hard to string together coherent sentences or may even have difficulty forming words at all. In more severe cases, a person may be completely unable to speak. Number 7. Memory problems. Memory problems can be a sign of a stroke due to the intricate connection between the brain's various regions and functions. When a stroke occurs, it disrupts the blood flow to a specific part of the brain. This lack of blood supply deprives that region of essential oxygen and nutrients, leading to damage or even death of brain cells. Memory functions are primarily associated with a part of the brain known as the hippocampus, located in the temporal lobes. However, the brain works as a highly integrated network, and disruptions in one area can have cascading effects on others. In the case of a stroke, it's possible for the affected area to include not only the hippocampus, but also neighboring regions or even interconnected pathways. This can lead to difficulties in forming new memories, retrieving existing ones, or both. Number 8. Lost balance. When a stroke occurs, it disrupts blood flow to a specific part of the brain, which can lead to a variety of neurological symptoms. In the case of loss of balance, the affected area of the brain is typically one that controls coordination, spatial awareness, and muscle control. This disruption can result in a person feeling unsteady on their feet, struggling to walk in a straight line, or even experiencing a sudden and unexpected fall. Additionally, a stroke can affect the brain's ability to receive and process signals from the inner ear, which is a key component of our balance system. This further contributes to the sensation of unsteadiness. Number 9. Nausea and vomiting. When a stroke occurs, it often affects specific regions of the brain responsible for regulating bodily functions, including those related to digestion and balance. The brainstem, located at the base of the brain, plays a crucial role in controlling various automatic functions of the body, including nausea and vomiting reflexes. In the event of a stroke, especially in areas that impact the brainstem, there can be a disruption in these regulatory functions. Additionally, a stroke can cause increased pressure within the skull, a condition known as intracranial hypertension. This heightened pressure can stimulate the emetic center in the brain, which is responsible for triggering the nausea and vomiting reflex. Essentially, it's a protective mechanism that the body employs in response to the stress and damage caused by a stroke. And that's the end of the video. As always, if you have any health concerns, it's essential to seek advice from a professional healthcare provider. Thank you, and we look forward to seeing you in our next video.